Jennifer Berry, Senior Editor of JEMS and JEMS.com. I'm with Travis Kusman. He is one of our technical editors. And Travis, you've been wandering the exhibit hall floor looking at some pretty cool products, right?
Yeah, absolutely, Jennifer. There's quite a few hot products here within the exhibit hall. I think one of the more interesting ones is actually a new sheet that was developed by Stryker. It's called the Speed Sheet, and it actually facilitates moving patients from the gurney onto a hospital bed and reduces the strain on providers' backs. It's essentially 2 layers of plastic, and in between that there's a lubricant which is actually activated when it comes in contact with air. So definitely be a big help for some of our larger patients.
Yeah, definitely. What about sessions? Have you gone to any cool sessions over the couple-day conference?
Well, yeah, absolutely. EMS Today is always an awesome opportunity to participate in a bunch of different sessions with some of the leaders within the EMS industry, and in particular this year there was a question and answer session with the Eagles, and the Eagles are some of the preeminent medical directors from the larger systems across the United States, and that was a great opportunity for the providers who were able to attend the conference to be able to interact with these physicians directly and talk about a lot of issues facing EMS systems today. And some of the issues that were discussed at that particular session had to do with whether we should or shouldn't transport patients that are in cardiac arrest who do not regain pulses in the field to the hospital, and what some of the risks are associated with transporting patients after cardiac arrest when they don't have a pulse to the hospital, including large number of accidents that happen when vehicles are traveling with their lights and sirens activated. And the group is recommending at this point that patients that don't regain pulses in the field, of course other than those involved in penetrating trauma arrests, actually not be transported to the hospital. And then there was a lot of discussion in that session as well about economic challenges that systems across the country are facing today in terms of having to make trade-offs between offering perhaps the latest treatments and clinical decision-making tools to their patients versus being able to retain caregivers, because obviously at the end of the day in a challenging economy like what we have today, some of those decisions are at the forefront. There was also some discussion there during that session about intubation in particular, and whether or not paramedics should be intubating in the field, and of course that's always a key topic and heated discussion there.
Right.
But one of the discussion points was just the level of training associated with intubation, and if medics can be trained properly and there can be good solid QA processes in place to ensure that indeed where there are issues arising with intubation, those are addressed, and providers have that availability to them, close interaction with their medical director, then perhaps that would be less risky. And of course discussion today that the Eagles are recommending some of the alternative airway devices, combi tube for example, as well as the King airway. Yeah. And despite the fact that there have been some questions associated with the King airway lately related to FDA and FDA specific approvals for the device, that group of medical directors is still supportive of its use in the pre-hospital setting. So a lot of great information, a lot of great discussion at the conference this year, so would encourage those who weren't here this year to attend next year.
Cool. All right, well, thank you very much. I guess we'll let you get back to looking for some new cool innovations.
Yeah, there's plenty to see here. Thanks,
all right.
Jennifer.
Thank you.